Welcome to Shareholder Q&A, our production of Gorcom, in which we allow shareholders to post their questions online to have CEOs answer them. With us today, happy to have him back because it's always an amazing conversation. Steve McAuley, CEO of Empower Clinics, trades in Canada under CBDT. For friends in the US, EPWCF, and for friends in Europe on Frankfurt under AEC. As you know, typically when it's a Beyond the Press Release, another kind of interview, I'll do an intro so that people can understand what the company's doing, but this is shareholder Q&A, so we know it's a lot more the current shareholders are going to be watching, so we're going to jump right into it. Steve, welcome back. How are you, my friend?
I'm very well, George. Good to be back on the show. How are you?
Excellent. Glad to have you back, because whenever you're on, we've always got great stuff to talk about, my friend. And before we get into the shareholder Q&A, I'm not going to turn this into a Beyond the Press Release, but the fact of the matter is you had three big press releases recently. The partnership with CERES, Carolyn Shields being the Senior VP of Operations, and the announcement of Anthony Tomasello onto the board, which I'm really excited about. I'm excited about all three of those, but I love that. Let's just do a little brief talk about each one of those. The partnership with CERES, first of all. Man, how big is that? What do shareholders need to understand about how big this is from a numbers point of view, and how big it is from a validation point of view?
Yeah, it's a tremendous opportunity. We've been working on this since December of 2020. Going on 15 months, and it started back at that time with the anticipation of the cruise ship season reopening last year in 2021, and then the federal announcements came through, and of course, it got shut down again. So we kind of fast forward a year, and it's back on the table. But we maintained an ongoing working relationship with the management at CERES Terminals, always kind of nurturing, getting updates about what was happening. And then as kind of fourth quarter came along, get into December, the cruise lines are starting to activate again, and Transport Canada federally is, made no indications that, the season was not going to get going. And we come into the new year, and it's on, it's fully on. And the cruise lines are now incredibly engaged, and they're incredibly engaged with us directly. So we have this really interesting relationship that you've got CERES that manages the Port of Vancouver, a British Columbia Crown Corporation. You've got the cruise lines themselves. Some of them are smaller, but some of them are huge, and you think of the likes of Disney and Norwegian and Royal Caribbean. And this is all about servicing what looks like 1.2 million passengers over a 6-month season, which is primarily Vancouver to Alaska. There's some Vancouver to Hawaii, but those are a smaller percentage of the what is going to be in excess of 300 ships coming into port in Vancouver.
And what are we going to be doing? Because this isn't just this isn't a single facet here. It seems this is multifaceted, and they're really going to be relying on Empower, right? What are we going to be doing for them?
Yeah, well, one of the reasons why we made really what I believe the ideal partner for this is, one, we're Vancouver-based public company, and more importantly, public healthcare company. So we really presented ourselves nicely with the ability to provide overall healthcare management services and logistics that includes testing, but it also includes screening. It also includes the provision of medical services. Because imagine if you have, a traveler who maybe fails pre-screening, perhaps a traveler tests positive on one of the tests that are required. You have to start to deal with immediate quarantining of them and their cohort, whatever that might be. And up to and including, full medical access and perhaps transportation to emergency services at one of the local hospitals. So it's not just about, hey, we're going to be providing, rapid antigen tests or PCR tests. It's far more comprehensive than that. And so I think, again, with our testing capability, our healthcare management capability, it's why we announced just a short while ago our BC medical director, Dr. Tyler Kupal. This was all an important pre-step to make sure that when we get the MOU completed with CERES, we can be in a position to get accredited in the province of British Columbia, because British Columbia is regulated by the College of Physicians and Surgeons for testing services. So you can't just show up and start testing. You have to be accredited by the committee. It's called a DAP accreditation. And one of the main prerequisites is you have to have a local, medical director who has to be a medical doctor. And so that's where, Dr. Kupal came into play for us. So,
and by the way, I want to talk about that in a bit, how when you did announce him, people thought, why is this being announced, right? But they just don't realize that this is a chess move being made by you and Empower that's necessary for something bigger. We'll talk about that when it comes to Tomasello and Carolyn. I want to finish off CERES with this though. Some investors have expressed concern that since the announcement, we've heard that governments are dropping or going to be dropping mandates. And there's concern that, well, there goes 15 months of negotiations down the drain because, CERES and the cruise ships aren't going to need this anymore. It's not going to be mandated. What's the response there?
Well, we're not worried about that at all. We know what the mandates are, but one of the things to keep in mind is that a number of the cruise lines they create their own standards. So especially the big guys, so they choose to have a higher standard of testing requirements, screening requirements, protocols. So as an example, some of the conversations that we're having, and these are one-on-one conversations with the cruise lines themselves, and really they want to talk to us to understand our capabilities and our ability to deliver. They're typically not familiar with kind of the Canadian landscape from a regulatory standpoint, testing requirements, policies, procedures. So they're going to rely upon an organization like ours who has tremendous experience both in Canada and in the US. We understand both of those regulatory markets or frameworks. So when we talk to them, I can talk to them about our experience and capabilities with the FDA EUA status, and then translate that into the Health Canada version to help articulate and explain that some things are similar, but some things are distinctly Canadian, and that they have to be aware of. So what we're seeing and what we're hearing in our conversations is it's going to range up until some of the cruise ships are going to demand or require 100% of all embarking, so onboarding passengers, to get tested the day of travel.
Whether American or Canadian, they want them tested.
100% of the passengers. That will likely play out to be a rapid antigen test based on kind of the recent announcements with Canada. The other thing that will take place with many or most of them is they're going to require crew testing. And as you may be aware, there are many hundreds, in some cases thousands of crew members per ship, and they will need to be tested multiple times per week, depending on the policies of the individual cruise line. The other important factor to keep in mind is something that probably little known or people maybe don't think about. 70% of these 1.2 million estimated travelers for the cruise season are US people, US-based people. They will all require a day of rapid antigen test when they come back and they disembark, because they need to get back on their flight to get back home to the United States. So we will also make that service available to all of those travelers. Now, in most cases, it's likely going to be falling out that travelers will be the ones who will be paying for the test itself. Some of the cruise lines have indicated that they will likely include the cost, at least for the day of embarkment testing, but they certainly won't provide coverage for any optional return testing. But we know it's not optional. These travelers, they have to get a test somewhere, so they may as well get it from us the moment that they disembark from the ship.
Yeah, they're not going to get off the look, practically speaking, I've been to Vegas and California and a bunch of places, and you're scrambling, looking around, wandering the streets looking for a place that they're not going to do that, right? If I'm on that cruise ship and you're right there, 99% chance I'm going to say, hey guys, hit me with a test. I know you can't give us numbers, all right? I know you can't give us projections or anything like that, but you're talking about 1.2 million passengers. You're talking about all those crew. You're talking about getting on and some when they're getting off. See, are the numbers as big as I think they're going to be here? Yeah, if in terms of revenues for the company, how
Look,
is this game changer revenues? Like, is this wow, we've never seen before revenues?
yeah, of course it is. The capacity models that we're looking at, we have all the draft schedules for the entire season, and it's subject to change here or there, but directionally, it appears that there's going to be a lot of tourists coming for these cruise ships.
Sure.
And
Demand.
what we see in other markets. So if you take U.S. markets, we're seeing price points in and around $100 US, sometimes 125. We've seen $150 US for secondary PCR tests, and this is not sort of me guessing. This is like, as an example, myself and some other team members went down to the Port of Long Beach in the fourth quarter to witness that's a CERES run terminal. So we went down to watch the processing of a big Carnival cruise line. So we could see 4,000 passengers arrive and disembark, and 4,000 passengers embark, and watch the entire screening and testing process take place. And again, we're looking at the material, sharing the information with CERES and back and forth. And this is kind of the market. And, with most of these cruise lines being US or international based, they kind of have a basis of what to expect would be sort of the sunk cost of these.
Yeah, I think everyone kind of knows it's somewhere in that 100 150 range.
Yeah,
I was in California in December, and right there, $125 for me to get a PCR test back then. So I think
we absolutely are going to have overhead and labor costs to consider, and that's where these price points come from. We know that the actual test itself doesn't cost that price, but the overall administration of the overall healthcare services have operating costs that come with it, and those costs need to be covered.
Do you think at some point, look, I'm not saying any numbers here, but I guarantee you, I just wrote some notes. I guarantee everyone who's watching, listening to this, is doing back of the napkin math. And I think we're all coming up with some pretty astronomical numbers.
Yeah.
Do you think at some point it may be valuable, when you have a much better idea of what the season's going to look like, and you've determined your price points and overheads and all that, that it may be valuable to come out with some kind of projection or some kind of guidance as to how big this could be? Because its materiality is just monstrous to the company.
Yeah, it is. I mean, the concept of providing that guidance is probably going to be a bit difficult for us to do, but what we certainly will be able to bring to everybody's attention is the price points are going to be published services, right? You'll be able to go on to any of the particular cruise lines who will be participating, and that's public information right now. I mean, you can go to the Port of Vancouver website and you can see the draft schedule right now for the cruise season. So you can see whether it's Disney or Norwegian or Princess or Carnival or whatever, Royal Caribbean, they're all listed. And so, these ships range from, very large ones to medium to a few boutique sort of smaller ones. But, the volume is significant. So if anybody wants
1.2 million, either way, however you slice it, would be 1.2 million.
Yeah. So, I mean, I don't know whether it ends up being 1.25 or 1.15, it's in and around that range based on current, forecast. And those forecasts are coming from the cruise lines themselves.
Of course,
right?
Of course.
This is not sort of the other way around. Like we're trying to, engineer a count or a number. We're just receiving data so that we can do our capacity planning.
Yeah, they're giving you the numbers for that reason, saying, "Hey guys, just in case, these are going to be our numbers. Be ready for this."
Well, that's
they don't need you guys guessing, right? So, and I would think, and we'll move on to Tomasello, but I would think, Steve, that pent up demand means those ships are going to be pretty full. Those cruise ships are going to be pretty full for that Vancouver, Alaska run that people have not been able to do for a couple of years now. So that's
you're so right. I mean, we've been talking to the hospitality and the hotel and tourism industry for quite some time. We're kind of deeply connected in Vancouver with that industry, and there's a great deal of optimism with the hoteliers and the restaurateurs. The feedback is it's going to be a little bit easier to get into Canada now for, US travelers. So there's optimism that, that sort of, demand is going to sort of come back into the city and the province. And we know that the cruise line industry, is just such a big draw. And it's historic. I mean, that demand has been, in the Port of Vancouver and for many, many, many years. It's not new, right? So if you look back to historic demand, everybody seems quite optimistic from a cruise line perspective. So we're all just gearing up, right, for the logistics and the volume. We are having multiple.
By the way, Steve, devil's advocate, are you guys ready for this volume? I mean, this is massive. How confident are you and the shareholders probably thinking that, saying, okay, this is great, but are we ready for it? And I got to ask you, I mean, how on a scale of 1 to 10, how comfortable you feel right now that you're going to be able to, that you'll be ready?
Oh, I feel like we're going to be ready. I'm not doubting that. It does phase in. The first sailings are in April. There's not a lot of them in April. There's one small one in early April, and then it starts up in sort of late April. So we've got a little bit of time to ramp up. Right. We're developing all of our SOPs right now, our capacity modeling. We work very closely with CERES, who are very experienced at managing the large facilities and the port. And so we're all leaning on each other. The cruise lines are leaning on us. We're leaning on the cruise lines. We are very activated directly with the cruise lines themselves, which for me is great. So whether it's my chief of staff and biz dev, our CFO and others, Dr. Kupal, they're all working directly with the cruise lines now to understand exactly what their expectations are and making sure that we can meet those expectations. And I think in most cases it'll sort of run through the agreements with CERES, but in some cases it's looking like we might actually do direct contracts with some of the big cruise lines.
Wow.
So we're going to see how that plays out. But one way or the other, the service still will be provided, and the passengers of those cruise lines will access those services.
And I'm glad to hear that's going to be a soft launch kind of ramp up. That's great. Rather than come April 15th, 4 cruise ships are coming in 1 week. You're going to have a soft, because look, even restaurants, when they open, do soft launch ramp up. So that's awesome. So great. Can't wait to hear more about that, because it's not, and I'm glad you kind of alleviated some of the concerns of investors there who thought that, oh, well, now with mandates going away, this is all for naught. So awesome, Steve. Let's go.
No, it's not. I mean, I certainly understand that, George. I understand the position, and I just want people to recognize, we're under non-disclosures with CERES. We're under non-disclosures with the cruise lines directly. There's just some things that I can't talk about in advance, and we just have to be respectful and professional and careful. But please know that we would not go down this path if we didn't have a forecast that these testing requirements are going to be in place. And so, we're going to continue on, on our path right now. And we'll figure out, what parts of it we do ourselves, what parts we, bring in different partners with, because there's technology pieces that, we've got a great partner in Fobi, who's done some great tech development for us. And we've used it, in recent, conventions that we've run testing programs for and health services for, very effective technology platforms. And we've got great integrations and APIs already in place with Fobi. So, we've got a lot of, I'll call it, a lot of our bases are covered already. Again, as we've been explaining along the way, is CERES really has viewed us as just the ideal healthcare partner, because this is not just about one facet, administering a rapid antigen test. It's far broader than that, and we just happen to have the scope and capability to deliver.
Well, since you mentioned Fobi, just really quickly, because I don't want to go down a technology wormhole there, but I'm assuming the partnership with Fobi will be, you're considering or planning on delivering results to George, who comes off and needs to know his results through a digital wallet. Or so SMS or some kind of solution.
Yeah, well, there has to be a delivery of a result, and the result needs to be at a minimum a digital version. Some of the cruise lines we've seen, again, in some of our experiences down south, they have a paper version supported by a digital version. So at a minimum, there has to be a digital delivery and confirmation of the test result. What we're working through right now, again, with different of the cruise lines, is to what extent do they have a unique requirement, or to what extent would they be satisfied with the delivery methods that we already have in place? So more to come on that topic, but we know we've got great partnerships with groups like Fobi, who have tremendous capability to deliver this. I mean, they already know, they already can do it. Let's put it that way. So, and we already have our tech APIs in place with them. So more to come on that. We'll keep everybody posted along on that sort of progress.
Next up, so we've mentioned the BC medical director a couple times in conversation, and again, people thought, well, who cares? But they didn't realize that was a precursor to the partnership with CERES. So you don't just make random announcements just for the sake of putting out announcements. There are chess moves being made, and the one I have to ask you about, there are two, but the one that just came out is the appointment of NASDAQ healthcare executive Anthony Tomasello to the board. And I wish I could go through his credentials right now, but there's so many. I'm going to tell everybody to go through it because there are 3 paragraphs. I don't want to bore everybody, but most importantly, he was executive VP and chief and CTO of Stericycle, a NASDAQ company that he started with at its infancy when they just had $200,000 in startup capital, and it's grown to $2 billion in sales, $12 billion enterprise value, 14,000 full-time employees. What's this guy doing at Empower?
Well, we are just so incredibly fortunate. I was introduced to Tony in, I guess it was early November last year. And we hit it off tremendously at that time. We ended up having a number of immediate follow-up private one-on-one sessions. And, I have been honored to even have those conversations. I mean, Tony is a powerhouse, and he's a healthcare powerhouse. He's a NASDAQ powerhouse. He knows the investment banking community in New York like you wouldn't believe. And he carries tremendous cachet. And, I've talked about it for really quite a long time, is that we have a vision and a plan that we should be entitled to, when the time is right, to be able to uplist to a bigger market. And but I've also said that we can't just show up and then figure out how to be a NASDAQ listed company, right? We have to start becoming a NASDAQ listed company way before that takes place. And that's why the appointment of Jennifer Archibald, who's done it before for NASDAQ listed biopharma or tech, pharmaceutical type companies. It's why we've made the moves with the Medi Collective, and we'll talk more about that. So as I spent more time getting to know Tony, and more importantly, him getting to know us, basically I was being interviewed by him, not the other way around.
You were definitely auditioning for him.
Yeah, so we were.
He was not auditioning for Empower, not a powerhouse like this, that's for sure.
And I recognize that, and very respectfully, we had such good conversations. He's a very warm, incredibly intelligent, very successful gentleman, but by no means is he soft. He is tough as nails. He will bring discipline, added experience. It will help us with independence. It will help us with our charters and our various committees that we need. And we have to expand our board. We know that. And so we've been a bit patient. And just again, as I got to know Tony, I felt at one point it was now appropriate to make that request of him. And he jumped at it. There was not even a hesitation. And so I feel honored, frankly, on behalf of our company and behalf of our shareholders, that we can attract such incredible, capability and talent, and again, experience and cachet. And, I, for one, am looking forward to the mentorship that he can provide all of us, and leadership and frankly, independence which is a really critical factor for any public company, especially one with ambitions of uplisting.
And from my experience, I'll just add in 2 cents, and other people probably realize this, but not everyone does. Someone like Mr. Tomasello probably gets offers to join boards every week of his life, and will continue to get those. Hey, Anthony, I'm George Calm Healthcare. We're a great startup. I've seen you've grown a startup to $2 billion in revenue. We'd like you to join our board. Or bigger companies that are looking to expand, M&A. So the fact that he accepted, because he's a human, he's got a finite amount of time in a day, so he's got to pick and choose his board appointments. Man, we got to have him on here, because I don't want you to put words in his mouth, but we got to have him on here to say, what does he see about Empower? But I think what you can answer is, this is a chess move again because of NASDAQ and US expansion.
It is. We again had a real primary focus on getting the brand of the MediCollective live, focusing on Canada with the Ontario market first. But as I've stated before, I'd always intended on turning our attention back to US markets when the time was right. So again, the conversations that we had with Tony in the fourth quarter, there was a lot of validation that we received from him. He really believed in the healthcare model that we are developing. So it gave me, a lot of comfort and frankly, reassurance that, some of the things that we've been doing are right. And, it all takes time to put together. Everybody wants it to go faster all the time. We get that. But, we still are trying to build a great company here that's got strength and capability for the long term, and doing it in the right way. And we've been plugging gaps in personnel that I've said all along that we have, and we recognize it. We just keep on getting better and getting better and getting better, all the way along. So this is just another move for us. And we're just frankly so honored to have Tony join us at the board of directors. And I can't wait for, him to really, lean in and put his input and make impact to our board, which ultimately impacts our company, our direction, and the long-term value for our shareholders.
Well, when you said that he's got incredible connections in the investment banking world, again, you know this even better than I do, but when there's an individual out there who is part of the infant stage of a company, $200,000 startup funding, and grow to these levels, pretty much every investment banker in the world is going to bet on him and his team, again, individually or together. But if Anthony picks up the phone and says, "Hey guys, I've got something for you," he's going to get an immediate meeting. So I'm assuming that's going to be a really big part of his appointment when the time comes for Empower.
Yeah, it is. That's exactly what we're going to be so fortunate to be able to leverage. But again, there are many facets, to this. So, more to come on the topic. It's announced now. Again, as you said, people can look at the profile and the bio, and just be assured that this is a very positive step forward for our company and our future.
And then Carolyn Shields, Senior Vice President of Operations of the healthcare clinics.
Yes.
Talk about the chess move there. Again, fantastic pedigree, 22 years of biz dev in one of Canada's largest multi-special medical groups. Amazing success there. Everyone can read her profile as well. What's a chess move on her appointment?
Yeah, so we started thinking about long-term growth strategy and how to be most effective organizationally with the resources that we have, the talent that we have, or in some cases, the gaps that we have. And, again, for us to continue to grow rapidly in the right way, we need dedicated focus on what we'll call either business development, or we'll call it mergers and acquisition work, right? Sometimes, those terminologies are interchangeable. Now, we've all been developing our pipeline, whether it's myself or my chief of staff, Tenzin, or it's Jordan and Aviv with their connections. We've got a really healthy deal pipeline. But I felt that we're going to run into problems operationally where people are just reaching their capacity and things start to slip through the cracks. And that could be deals get missed or delayed. Operations within the Medi Collective are not optimized. You start to have service level issues, or you have labor issues or staff issues, or whatever issues may come that come with scale. So as we talked about it internally, back in early fourth quarter, we started to formulate this. So what could this look like? So we had some conversations with Jordan and Aviv together, very constructive, and really talked about their futures and where they see their skill sets developing. And they've really matured since they've joined us. They've done a great job at creating the brand of the Medi Collective and getting clinics opened. And even in spite of COVID delays, we're still operational, and we're seeing many tens of thousands of patients, right? So we thought, if we had the ability to pull them out of that day-to-day work, running the Medi Collective, could they be more effective at dealing with sourcing and delivering new growth opportunities, but also integrating those opportunities? And this is where there's two roles here. They kind of work hand in glove, but they're quite specific or independent functions. And the other thing that I needed to have going forward is to make sure that within our divisions, we are working with each of the strengths and capabilities of our own divisions as effective as possible. So as an example, we need MediSure's products to be in our clinics. We need the Medi Collective to pull testing products and new testing products in the future, or be a source for clinical trials if required, or pilot certain products in the future. So that kind of cross integration is an opportunity for us that we need to leverage, and we need to continue to do a better job of that. So one of the keys, though, if we were to make this work, would be we have to get a powerful, successful leader for the Medi Collective who has done it before. No experiments, no trials. This is, absolutely seasoned pro. We, found or landed. Actually, Carolyn landed on us. It wasn't kind of it was the other way around. We were approached by a recruiting firm representing her, and it just sort of was so timely, and we started to work on it. And so we got it in place. She's a tremendous fit to our organization, an absolutely talented individual, and brings just tremendous experience. She garners respect. She's very likable, but she knows how to get it done. She fits our profile.
Success that we see.
She does. She fits our profile of execution, like get things done and just get your head down and get it done. And so we've been able to sort of move the pieces around a little bit now to position ourselves in a more effective way to grow in 2022 and beyond, recognizing that our core operations of the Medi Collective are in great hands.
So let's move on to the Q&A part.
Sure.
And the first questions comes from Mark A on Agoracom. He's got 3. And he's asking first thing about the clinic acquisitions. Is the 8 operating clinic acquisitions delay because of the new CFO having to re-review due diligence on these, or is it something else? And can shareholders get maybe a firmer date for when each, because there are 2 transactions there. I think Mark A has one, but there are 2 transactions there. Yeah. And can you give everyone a bit of a firmer date?
Yeah, it really was not a factor of Jennifer, our CFO, joining. That didn't create some sort of new undue delay. It's really just deal due diligence and legal due diligence more than anything. So in both cases, so it looks, I think the way the signatures will go is that it looks as though the Northwood Group, which is in Sudbury, Ontario, I know that definitive agreement is signing ready now already. So it won't surprise me if something firms up on that this week. It's that close. And the Thornhill one in Greater Toronto area is just like literally right behind it, because the deal structures are actually quite similar, and so the documentation flow kind of just worked almost in parallel. And it's really, you've just got individual traits on one transaction versus another, which is legal due diligence. You've got to structure it based on what you discover through legal due diligence, and that's really all that's been going on. So I think that we're going to see some updates, or I guess announcements on that actually very quickly, because I just I know how far the definitive agreements are along because I've seen them, and so they're effectively signing ready now.
All right, so we're inside of 2-3 weeks. Not that I'm going to pin you to a date, but it sounds like we're like really inside of 2-3 weeks.
It's imminent now, yeah.
That's fantastic. That's great because again, when there are delays, and especially when you're in a risk-off environment where Facebook is down 33% in a month and Shopify is down 65% in 2 months, people start getting nervous about whether deals are going to close. So that's great to hear. On the new clinic openings, Mark A asked, shareholders understand delays caused by outside forces that are beyond the control of Empower, especially during COVID. Does Empower have new realistic timelines for new clinic openings?
Well, the big flagship location, which we call Etobicoke Lakeshore, so we were literally supply chain delayed on that when we couldn't get our finishing lumber in, and
somebody said go to Home Depot. Just go to Home Depot. I wish it was that easy.
Yeah, it's not quite that easy. So there's certain configurations that we have within our brand, but anyhow, all of those supplies landed a couple weeks back. I think there's been a number of photos shared on the various bulletin boards and maybe social media. You can see all of the signage and graphics are on the facility, and so as far as I know, again, it's really close now. I haven't had an update since sort of a week ago, just letting Carolyn and Jordan and Aviv do their work, but their stated objectives were to have this ready for us by the end of February. So that's fast approaching, and then we will really anticipate trying to do another full ribbon cutting ceremony on this location, and we'd like to do London, Ontario as well. Now that we're seeing perhaps some of the travel restrictions within Canada being eased up a little bit, and particularly in Ontario, it wasn't appropriate, previously to travel
or to get groups together. Maybe the travel even wasn't even the most difficult part. Is how do you justify if you're a health clinics company to bring together 100 people in one location?
No, we couldn't. So it's just one of those unfortunate, circumstances that we're all living through the last 2 years. So I'm excited to, get out and see the locations myself, finished, meet the team members and, have a good splash and ribbon cutting ceremony and meet, our great followers and shareholders. And, maybe we put together, George, some sort of town hall meeting, in conjunction with it, and, just keep communicating and keep providing updates.
Yeah, can't wait for you to come in, see everybody. We had to do the last one without you, unfortunately. Yeah. And then December, Omicron hit, so that was off the table. And that's gonna be really exciting. And the last question from Mark A, and also by Mike Banning and Andrew, so that way we're gonna take care of it in one shot, is what is the status of the SVH divestment and why is it taking it so long? Is Steve at liberty to discuss declines, attitudes, or lack of cooperation? Not that there is that, but he's asking if you're able to talk.
Yeah, it's it's taken far too long. It's frustrating, and I'm grinding away at it. We had a format or an approach that we, based on guidance from counsel, they recommended that if we kept going down that path, it would have the potential of creating, long-term liability. And I just don't want us having any, residual liability for the public company over this transaction. So we had to kind of pivot the format, essentially going from a share purchase agreement to an asset sale to help kind of, mitigate any long-term liabilities that, could be in place. And, just unfortunately, it's just been a bit of a grind to get through it. And
how's it ETA? Do you have a ballpark ETA? Is there light at the end of the tunnel, or are you still grinding?
There is light at the end of the tunnel. Frankly, I had to really, kind of put my foot down hard on this. And, the alternative, if it doesn't get signed here in the next, literally number of days, I'll take a different position, which is I would just close the remaining locations. Like we did in the Pacific Northwest with that last Portland location. We have to be fully either divested or out of those forms of clinical services for our public company. It's just something that we know has to be done, and it will bring benefits to us in many formats going forward. It's just unfortunately this last little piece has taken too much of my time and attention, frankly. I've really.
But you put your foot down now. There's a line in the sand.
There's a line in the sand.
Or just shut them down, and
yeah, that's exactly it. And so it's just it's kind of a harsh reality. I wouldn't normally even talk about a scenario like that, sort of in this format, but that's where we are.
All right, perfect. And Mark went on to say, "Thank you, George and Steve, for your time. Much appreciated." Next up is Mike Banning. First question. What is the company's cash position? Will there be another raise soon? And when do you project the company to be cash flow positive? I think a lot of those you can't really talk about because those would be material without having a proper press release. So would it be accurate to say company's cash position, he's got to refer to the last financials?
Yeah, well, exactly. I mean, we're, obviously have started our year-end audit. It's well underway. Jennifer's doing a great job in leading that. As a former auditor, she knows what it's like on both sides. So that got started sooner with more precision than in prior years. So I'm quite pleased with that. It's not something that I can't, comment on the specifics of that.
You're not allowed to.
We've been able to, have some, have kind of the growth that we anticipated. We've got, new clinics that are, we're seeing patients, and patients turn into medical billing. We see, Kai Medical having more traction with their services. We've got the new mobile locations in Texas that have started now. Every time, you are to, test or provide a vaccination to a patient in those locations, that becomes billing, and it gets into the medical billing cycle, and we end up getting paid for that. So I'm pleased with that. Obviously, the pending CERES stuff, isn't generating, cash flow for us today, but it sure is not that far away. And then, we're not touching much on Medisure in this conversation today, but Medisure are really doing great. They came on board and they just got it right away, and they outperformed our expectations for the first 6 months and had a nice fourth quarter. That momentum has continued. They've got new products coming to market. We announced the vitamin D test. We've already paid for that inventory that's coming over right now. We're in conversations with all the various pharmacy partners, that we all know, and we're getting great feedback on that product set. We've got their new diabetes blood glucose monitor coming to market here in the second quarter, I believe, also. And then we've got our Health Canada pending approval for our own rapid antigen test. But they're also helping us on the whole concept of warehousing and 3PL. And we just received 200,000 rapid antigen tests So we have those in inventory. Now, a bunch of those were already pre-sold. So we are seeing some nice revenues and cash flow coming in from this new service of rapid antigen test selling of kits. And a lot of that is primarily going through the pharmacy networks. And so we've got another 200,000 units on the ground that we're selling right now. And so if anybody, wants some rapid antigen test kits or has referrals, we have inventory. And, I think everybody may know that most of the Canadian inventory got scooped up in January by government. And so we had to, go find some alternate, sources of Health Canada approved product. But it's on the ground right now, available for sale. And Medisure are doing a great job on helping not only sell them through their own brand, but facilitate the orders and the collection of cash. And we are seeing some nice cash flow coming back in from that through our Kai Canada division.
So fair to say by summertime, when you talk about the acquisitions being closed, CERES in full mode by, June, May, June, July, it's going to be in full mode. Medisure, it sounds like cash flow positivity is probably not going to be a problem at that point.
Well, that's what one would think. So, we don't have enough data in hand to, put that date, line in the sand in the future. Now, Jennifer is working, very sophisticated cash flow models for each of our divisions, and then rolling that up into, an overall cash flow model, and considering, the new opportunities that are coming our way. But, you look at, you take the two acquisitions that are pending, these groups, each do 4.2 million in top line right now. And that's just providing primary care services. It's not adding in the additional types of services that the MediCollective as a group wants to provide, right? Paramedical services. And we ultimately really like the specialty services like, teledermatology with MedX Health, and we like cardiology, we like nephrology. So a lot more to come on that. And Tony Tomasello, definitely is going to help us in some of those key specialties, because areas that he's already heavily involved in.
Next question is, how's the 2021 audit come along? Will Q4 and 2021 statements be released on time? As most of us know, last year there was a significant delay, but that was for a good reason, because you made two fantastic acquisitions that happened to take place in Q4 at the very, very end, and you didn't have a CFO. So how does the 2021 financial year-end audit looking?
Yeah, good. As I said, we got an early start. Jennifer is an absolute pro at this. No excuses for what happened last year. It doesn't matter acquisitions are late or not. No excuses. So, we've got to get it done and get it done on time. We changed a lot of aspects of our audit team approach this year. We moved it all to Vancouver. Out of Toronto, we're already seeing a material improvement in communication and turnaround time. It was one of the key factors in our decisions about audit. Right. And so
time zone, just those two.
Oh yeah, and it's just resources being able to work more closely together. Yeah. So we're seeing a lot of improvement already. I can see the speed of responsiveness on both sides, from our side and also with our audit team and audit partners. So far so good, right? There's nothing that's been brought to my attention that would indicate a delay.
And you got a great CFO who, no offense to you, is probably a lot better doing this than you are, and me, right? Than any of us when you have a fantastic CFO.
A lot better. I'm going to have my speed of gray hair is being reduced as we speak.
Banning goes on to ask, what's going on with Kai and its lackluster performance? What does Kai look like in a post-COVID world?
Yeah, so I felt we're not performing well enough. And I'm obviously not going to share the conversations, but we've had some stern conversations about this performance. And I think that translated into, some of the new opportunities that came our way in the fourth quarter. The Gala Games conference that they did in Las Vegas was highly successful. We've been fully paid out on that opportunity. And it also became a good framework And I think it demonstrated to the team at Kai is that, you know what, they can do this. If they set their minds to it, they're as good as anybody out there. But you've got to have a business development mindset to go win the opportunities. And that really led to, you know, these new mobile sites that have been put up. We're starting them in Texas, but, you know, we're looking, you know, closely and seriously about other states, starting with Tennessee and Arkansas. But we certainly need to know, can we handle these 4 in Texas? It's a huge market. It's right in the backyard of Kai Medical. So, you know, I'm looking for them to continue to fill capacity in the lab. To answer the question, post-COVID, we've been working on this, you know, for quarters now. As I've said before, we're working on the development of a multitude of direct-to-consumer testing products that have nothing to do with COVID-19. And so the key ones that we're starting with are really think around, these are blood spot based tests, self-administered at home, returned to the lab for processing. Think of, you know, women's health, men's health, different disease states. I think the pipeline on the initial group of products is 9 different versions, all again using existing machinery that we have in the lab, but not molecular testing, but actually blood-based testing. So we anticipate diversification. One of my concerns always, and it was the same as I looked at MediSure. My concern with MediSure is the same concern at Kai Medical, is concentration risk. And it's incumbent upon us as a leadership team and a board to recognize where concentration risk might exist and then determine what you might do about it. Now, COVID-19 testing and protocols may be with us for many years for all we know. We certainly anticipate that, you know, the 4th vaccine boosters are coming. I was watching, British news earlier, and they're about to announce, 4th booster shot. So I would anticipate that type of protocol is coming, really in all parts of the world. So we don't know how long that's going to, COVID-19 aspects will be with us, but I do believe that we have to plan for a time when maybe that revenue cycle diminishes and we must have more diversified revenue cycles. So you see it in MediSure already. That's diversification out of diabetes, but leveraging their amazing skill with Health Canada, their amazing capability as a medical device company, and their incredible capabilities to do warehousing, packaging, and distribution. So again, that's about alleviating a potential concentration risk. And in their case, it was medical diabetes product. So we diversified that.
And Michael Schmidt also, thanks Michael, he had also submitted a question about Kai and how it was doing. So I won't ask that again, but I want to just acknowledge Michael for posting that on Twitter.
Thank you.
Mike goes on to ask, when you expect expansion to the US?
I mean, it's really, 2022. We're obviously, we're already in the US. We're obviously changing a few things in our footprint, but we are already in due diligence on a multitude of US-based opportunities. So, we knew that we had
There's a reason for Tomasello.
There's a reason for Anthony. That's correct, and there's a reason for the organizational adjustments to free up Jordan and Aviv to further develop these pipelines. And so all of these kind of moves give us the ability to focus with purpose on US opportunities, new US opportunities. What they look like, time will tell. I know what we're looking at and kind of the direction we're sending our guys along in. But as they're ready for prime time, of course, we'll announce them. But be assured that work and those conversations are already started and are already taking place.
And last question from Mike, and I'm not sure I agree with the premise, but we'll ask it. Why do you keep over promising and under delivering?
I don't know that that's completely factual. We're doing our best out there. It's a funny kind of world, right? That we live in. I'm talking about public company life. If we have a week or 2 weeks where we don't have news, then people seem to get upset with us. And then if we have too much news, then people just say, it's just noise. So it's a fine balance. I think what we're doing in 2022 is we're kind of taking the position that, we'll probably have less sort of ongoing, press releases and really try to focus on more substantial and substance-based. And that will really be a reason why, maybe we see, some gaps in sort of news flow or communication. There's no shortage of work and opportunity, that we have. I think that we're doing one heck of a job. I see how dedicated and how hardworking our team members are each and every day. And I think if you start to add up our divisions and what they might represent here in 2022, I think we might all look back and go, that's pretty darn good work in such a short period of time. And this stuff just doesn't happen overnight. And I know everybody likes things to go faster, but I think we're doing a pretty good job at setting up that growth potential so that we can see these opportunities and our sort of healthcare structure will start to see that really large increase in top line and then eventually, positive free cash flow over time. But the pieces certainly seem to be in place, in my opinion. Our leadership team agrees. Our board of directors agree. And so
I got to tell you, I agree. And not just because we're here, but I've been doing this for 25 years, and growth companies have staggered growth. It doesn't move. You're not IBM, you're not a bank where you can just, you can project every move for the next 12, 24 months. It's staggered, but do things happen slower? Yeah. I laugh sometimes. I look online and I see questions or criticism of you, not very often, but when I see it, it's what's taking so long? How hard can it be to do that thing? Right? I laugh. I say, hey, come on, I know you're impatient.
It's hard. It's hard. Doing deals is difficult. The hardest part about doing deals is getting pen to paper on both parties at the same time on the same document. That is an art in itself. The 95% of upfront work and due diligence, a lot of folks do that. What I've always been good at, and I carry that through to what we're doing in Power, is getting both of those pens to paper at the same time. And it's not always a straight line. Sometimes, deals kind of go off the rails. You got to figure out how to get back on the rails. And sometimes they run so smoothly. You don't have to worry about a thing. It gets done and you're like, great. And then we move on. But that's not always like that.
And I'm going to move on to the next question with this first. When I said this to somebody just the other day, I said, hey, you and your wife, or you with your buddies, how long sometimes does it take to set up a dinner with somebody that you really want to get together with, and you want to get together next Friday? It doesn't work for them. They're saying 2 weeks from now, it doesn't work for you. And they're just trying to get together for dinner. Right. Yeah. So how about when you're trying to get an acquisition done? Right. And like you said, pen and paper at the same time, because Empower might be trying to acquire Agoracom. And I say, yeah, Steve, that would be a great idea. Let's do it. But for the next 3 months, I'm focused on launching a new initiative. So I'm saying, can you wait 3 months? And, and then you're going to say, well, George, I could, but then I'm going to be in the middle of my CERES partnership and I'm not going to have a lot of time to focus on you. Yeah. So that's just the reality, right? Which is, even if you and I want to get some, by the way, not that Empower is buying Agoracom, but even if you and I want to do that, right? Getting pen to paper at the same time. So everybody, patience sometimes. It's different if Steve comes on and says, hey, our LOI to acquire Agoracom or GeorgeCom has failed. That's a different story. There's some explaining to do what happened, but if it takes a little time, it takes a little time. So yeah. I'm gonna kind of add perspective there that it's hard enough to get people going out to dinner on the same Friday night. So put that in perspective when you talk about two people who don't know each other trying to merge their companies or getting M&A going. David Young on Twitter, will Kai Labs be handling ship testing in Vancouver?
No. Kai Medical out of the United States is a US company. Their accreditations and certifications are as a CLIA and COLA US-based medical laboratory. The products that they use, other than our saliva-based PCR test, are not authorized for use in Canada under interim order. So it's kind of like straightforward answer. We have a division in Canada called Kai Medical Canada. That is an entity that we use for the import and sale of rapid antigen test kits. We also use Medisure, but the CERES overall, program or relationship is with Empower Clinics, and how we determine to best utilize our various divisions, their capabilities and their resources, is up to us to determine. I'm just grateful that we have those key diversities to fall back on and expertise to use. And it was one of the reasons, again, why we were even at the table on this conversation, is because of the diverse healthcare capabilities that we have within our entire network.
Jay Wilkinson on Twitter, and the last two people, Steve. Jay Wilkinson on Twitter, how many doctors will be on board by the end of 2022? Again, that may be a bit of a projection that you may not be able to give, but still.
Well, I can give some context near term if that helps. So assuming that we get the 2 clinic group acquisitions closed here in the near future, post-closing, I believe the number is that we would have actually 75 medical doctors, on staff in our portfolio, and well in excess of 200 staffers just in Canada, and actually just in Ontario, just based on. So let's say by the time we get out of the first quarter of this year, that's kind of what the profile looks like. Then depending on the continued organic growth openings, which will continue, throughout 2022. That's always going to add medical doctors and other, techs and practitioners. And then, we have the network, whatever we do in the US, obviously that's going to impact, our medical doctor, I guess, population. But, it's pretty substantial already. And that's why, the decision to, be able to bring on a Carolyn Shields, again, is just so important, right? Like, this is not like you're like a mom and pop, small clinic. Is we're now a clinic group with many hundreds of employees, and well on our way to north of 100 medical doctors and 800,000 patient roster.
Finally, Mike Waugh has just updates on 3 things. First of all, how is Medix performing in the clinics?
You mean Medix Health, teledermatology? Yeah. So a bit early, to sort of put out stats right now. I don't have them at fingertips. I'd say Carolyn and Jordan Aviv are going to be better on that. Certainly, we could provide an update, in the next little while. I think we can get, Mike from Medix Health and even myself, and just to talk about how it's going. I believe I saw some recent updates on social media about, I believe it's 4 locations that they're announcing where the teledermatology service will be up and running. I know at least of 1 or 2 locations where the service is already operational. So just let us get some stats on that. I don't have them at present, but it's a great topic and a great question, and we'll come back to everybody with some updates.
Plus, I've got to think December, January, February, plus layer Omicron shutdowns and, and people pulling back, that you probably don't have enough of a data set there. And you probably want to get more data when things are more open and flowing, and even the weather being a little better, right? How many people?
Yeah, I mean, well, the data is the data. So, I mean, whatever the circumstances are that either slow it down or delay something, the data is still the data. So we can definitely get some updates on that and say, yeah, okay, do we think it's a good baseline or not? What's the feedback from the patients? What is the feedback from the medical doctors? What's the feedback from Carolyn on the service?
Update on the referral program with Air Canada.
Yeah, so I mean, that came to a standstill with the Health Canada matters that we had to work through. The program with Air Canada was set up for U.S. travelers only, coming into who would need access to a test to come into Canada. And so, I think that overall, I don't think there was a lot of traffic, generally speaking, there. And now with the recent updates from Canada on the testing requirements to come into Canada, with a PCR test no longer being required, I believe it's as of March 1st, if I'm not mistaken. So, I wouldn't bake in anything related to that Air Canada referral program.
And finally, update on the performance of kitest.ca.
Kitest.ca, same thing. It was pending reactivating. So it was active, but you couldn't process a purchase because we had to work through Health Canada updates. We got all of that done. We had inventory in Canada. I know we had a big order of 1,000 units that just went out a couple weeks back. So some good business there. And right now, I think it's sort of a let's step back and take a look at what we do with the kitest.ca as it relates to the saliva-based PCR test. Now, keep in mind those platforms, whether it's kitest.com or kitest.ca, was always intended to be a diversified platform for a multitude of tests. So we would, as an example, expect in Canada, the forms of like the new Medisure rapid vitamin test, the rapid vitamin D test, is a product that should be made available on kitest.ca, right? The platforms are there. It's meant to be a platform for diversified direct-to-consumer testing products, not just a singular COVID-19 test.
Steve, an hour and 5 minutes into it, and it was awesome. Thanks to everyone who submitted great questions.
Yeah,
even some hard-hitting ones. And nothing was deleted. So what I love about this is we presented Steve with the questions. You didn't even know the question in advance, right?
No advance notice of the questions. So the format's good, right? It's free flowing. I'm typically pretty good with the details on kind of what's going on within our organization. And this again, George, thank you. It's a great forum. I enjoy talking about the complexities, the nuances, the exciting things, the difficult things. It's not always perfect. We're trying to get better every day. We're trying to fill gaps every day. But everybody has my commitment that we are working just tirelessly on behalf of everybody. And I hope that some of these recent announcements, which are really appointments, are starting to make sense for everybody.
Yeah, the picture, the chess moves are starting to show the strategy. Yeah. Is like, oh, that's where he's going on the chessboard. But by the way, Steve, when you say that too about, not everything is perfect, one thing I've also learned is that the biggest companies in the world, we think everything is just perfect. They got all the money in the world. They got all the manpower they need. And that's not the case, right? They're always putting out fires. There's always something that's not quite the way it should be, and they need to make changes and things like that. So yeah. If it happens with the Fortune 500, it's going to happen with Empower. It happens with the GoreComp. It just happens, right?
Yeah, of course it does. I mean, that's reality. Yeah, that's reality, right? And so, we live, I live with that reality every single day, and so does our team. And, we balance the demands of, public markets and capital markets and our followers with the demand and responsibility to build a great company and kind of figure out how to get those two working together at all times. And as you said earlier, it's not always a straight line up. It ebbs and
Never.
flows. And but we get it and we understand it, and we kind of we know what we're doing, and we also are bringing great talent to our team to help us get better as a collective, as a group.
And I'm going to leave it last word to you. How great do you feel? It's third week of February. How good do you feel when you look forward to the end of 2022? How positive, how confident are you in the success of the company?
Yeah, I'm really happy with where we're going. I have a lot of clarity about where we are and where we're going and where we need to be. And I've got a team that works with us, that has complete belief and faith in the business model that we're building. They bring tremendous feedback, tremendous insights. They push back when necessary. We debate all the time. We have an inclusive environment in how we decision make. And again, I think it's why we're attracting such great talent to us, is that I think we're building something special. And to answer your question, so I am really confident about what our 2022 looks like. We got a heck of a lot of work to do, but I tell you what, I think we've put a really strong base in place that we can continue to build upon.
All right. Thanks for joining us, Steve. Always appreciate it. Look, and more than an hour, and not very many CEOs do it. And the fact that you do it, you engage, communicate is such a big level of confidence for me, because if someone's hiding, they're hiding, right? And when you're out engaging and answering questions, it means that things are going pretty well. Thanks for joining us, buddy, and can't wait to have you back.
Thank you, George. Appreciate your time.
For everybody at home, you've been watching or listening to CEO Steve McAuley on podcasts, whether it's on Spotify, Apple, Google, or favorite podcast platform. He's the CEO of Empower Clinics, trades in Canada under CBDT. For our friends in the US, EPWCF, and even for great supporters in Europe, 8EC on Frankfurt. If you believe in the future of healthcare, if you believe in the future of this company after you've heard what they've had to say, then go do your due diligence, get to the profile on the Agoracom, and then from there, hop over to the Empower Clinics website, do your deep dive due diligence. Thanks for joining us. Have a great day. See you next time. Hey guys, this video is over, but don't forget to help your company by liking it and even leaving a comment below. And then don't forget to help yourself by subscribing to our channel and never missing another great Agoracom small cap video.